you're all very welcome. This is our first seminar of the year, and it follows the format that we first rolled out last year, when of course everything went online, and I think we're all pretty used to that now. And just for practical purposes, to explain that whilst attendees can see the panelists and see myself and hear what we're saying, you're muted both, I think, both camera as well as your microphones by us as the hosts. You're very welcome, though, to, as the presentations go on, to submit questions using the Q&A box, which will be at the bottom of your screen. Not the chat function now, the Q&A function, and I'll collate those questions in that do come in, and we'll put them to our panelists in between each of their two presentations. These presentations, so first of all, this afternoon's seminar is going to explore the ways in which Belfast as a city has responded and is responding to the needs of its citizens, and particularly excluded or vulnerable citizens during COVID-19. So that means we'll be having a look back at how we as a city responded in the first instance and how that support is being carried on now as COVID, of course, carries on as well. It's about sharing that local knowledge, sharing the evidence of the collaborative response that's been used to deliver services to those who are most in need during something which is totally new to us all, totally unprecedented. And the reason for doing a seminar such as this one, and why Belfast Healthy Cities are doing this, is to inspire conversation, to spark some debate, to look at best practice and see, can we learn from each other? Are there changes which we can make? So my name is Brendan Mulgrew, and I've been working with Belfast Healthy Cities for more than 10 years now. And part of the role and the function of BHC, Belfast Healthy Cities, as a member of the European Healthy Cities Network of the World Health Organization, is to share experience and to make sure that as a connected city, we're able to learn from each other. And sometimes other cities across Europe will look at what Belfast is doing and pick some of our ideas and some of our experience. And of course, it happens in the other way as well. So the presentations that we'll hear today from Kelly Gilliland from Belfast City Council and Malina Virtejanu, from the Forward South Partnership, who's representing the Roma COVID Helpline. They were first aired at the World Health Organization Healthy Cities Network annual conference, which was held in Belfast 2 years ago, a fantastic event. And this year it was due to have been held in St. Petersburg, but of course it again was online. But in some ways, that meant that more people could attend, and in fact, more people it meant there was more input and presentation for Belfast in the online virtual way than there was had it been that sort of more traditional in-person conference. And we thought that the presentations which you're about to see today were so good and so worth sharing that's why we've held this event, and we'll be back online this time next week as well. So you will remain muted with your camera off. You can submit questions. I would encourage all of you, if you're hearing something which particularly strikes you as interesting, noteworthy, worth highlighting to the wider world, please tweet that out. Please use the hashtag #HealthyBelfast as well. And I should just point out that both sets of presentation slides will be made available on the Belfast Healthy Cities website after this event. And we are recording the entire Zoom event, and we will upload that over the next day or two as well. So those will be available to be viewed and to be shared, and they'll be publicly available on the Belfast Healthy Cities website. So Kelly, can I put you on notice that in a few moments I'm going to ask you to start your presentation while I introduce you, please. Kelly Gilliland, we're delighted that Kelly's been able to join us, as we did a little bit of a run through earlier on. Kelly was juggling homeschooling along with delivering her day job in a fantastic manner as well. And of course, that's an issue which many of us are facing at the moment. And that juggling of dealing with COVID in the home while schools are closed is part of living with COVID. Kelly has been with Belfast City Council since October 2019. A little bit more than a year, and her role there is as neighbourhood services manager within the City and Neighbourhood Services Department. And while her geographic remit is from North Belfast, Kelly specialises or covers the areas around health, sport and leisure portfolios within the council. And in this last 15 years, she has worked within the health service before moving to local government, and was the Health and Social Wellbeing Improvement Manager with the PHA, the Public Health Agency, leading on the topics of drugs and alcohol, mental health and suicide prevention for the Belfast and the South Eastern Health and Social Care Trust areas. So, Kelly, are you ready then? We take us through your slides, and I'll mute myself here. Thank you very much, Kelly.
Okay, thanks very much. Thanks, Brendan, for the introduction, and thanks, Anne, for organising everything. So basically, I'm going to take you through the presentation that I gave to the WHO conference, and obviously this was based on a report that we had pulled together on the back of the COVID response that the council was involved in. I'll just move to the next slide. Why am I not moving to the next slide? Hold on. Oh, there we go. Okay, and before I start, whilst I'm presenting, I suppose, on behalf of Council, we really, within this report and the presentation, wanted to get across that the response in Belfast was most definitely not just solely with Council. As a matter of fact, it was a range of partners, both at regional, local, and very much at community and voluntary level. And you can see from the range of logos there that were featured on this slide, you know, some of the partners that were involved, whether that was from direct delivery, as I say, at community and voluntary level across north, south, east, and west of the city, whether it was SOS coming on board with us to help deliver food parcels, you know, the direction that we were getting from the department in terms of what we were required to do, and then the bigger community and voluntary players like Red Cross, everybody had a vital role to play in that. And that's just to acknowledge that right from the outset. I suppose we started this a bit differently, and we started with the key achievements first and foremost. I mean, this was really covering a 4 month in terms of the food parcels, but really a 3-month period from April to June. And as I say, acknowledging in that first box there that the local communities were the first responders. Even before DFC approached Council, you know, community and voluntary sector had already mobilised and were already responding, and it was about us linking into that. In terms of the hub and the request from the DFC for councils to establish hubs, we were able to do that within a 9-day turnaround, and I'll talk more about that later on in the presentation. In terms of that, then that hub and the different elements within it, you know, we handled just under 10,000 calls within that period. Most of those, majority of those, were in relation to food and support for food. We also recognise that over 5,000 calls were received by the community run helplines. They weren't in all parts of the city, but certainly there were several in different areas. And also that 4.5 calls were actually proactively then made by the contact centre, you know, when we were getting to the closure of the scheme, just to make sure, you know, where people were at with the food parcel scheme coming to an end. We also, as part of that process, developed area teams, and it was the first sort of step for council to move into that area focus. And we had to do it at quite quick speed. You know, the north, south, east, west teams were set up then to deal with maybe more complex queries, people that were more vulnerable, people that were needing wider welfare support, and again, very much linked in with community and voluntary partners on the delivery of that. I actually can't see with my thing now, hold on there. There we go. And our last one, yeah, so obviously communication was an issue too. You know, we were being contacted by people where maybe English wasn't their first language, and where there was maybe hearing difficulties, a lot of older people. So we also took that on board, and throughout that process, we were looking at training opportunities, skilling up opportunities. And one of those was the big word training, specifically in terms of English, not as the first language, which we had to employ on a couple of occasions and worked really well. Food parcels then, for a bit of a focus, I mean, even that number, over 107,000 food parcels delivered, and hot food delivered as well, particularly by community and voluntary partners. 50,000 of those was from our hub, from the council hub, from the DFC supply direct, and then 50,000 obviously then came from community organisations as well. Prescription pickups were a big part of that as well, obviously with people not being able to get out and about, certainly in terms of shielding, and again working with partners to deliver just under 10,000 prescription pickups or picking them up on people's behalf. And then community and voluntary partners were very creative. There was things like resilience packs were provided within the community. Funding was another big element of the response, and that just notes the amount of funding that was put out as well, through council, through allocation from DFC, and also elected members assigning further funding from council's own funds to that. So over 1.6 million put out, over 134 organisations availing of that. You know, over 150 organisations directly receiving funding. In terms of obviously making it all happen, you know, communication was key. And again, it's just recognising that people gave their time to participate in weekly meetings at a community level, very much so again on that area basis, north, south, east and west, with our staff linking into those. And then also, you know, we were linking in weekly with partners such as the Trust and DFC and Advice NI. So that was a key part of the process as well. In terms of a wee bit of concentration then just on council itself, and this is what was called the Belfast City Council Community Hub. As I said, DFC approached us at the end of March to ask us to establish these, really to help us, as I say, with the food parcel distribution. We spent that first week of April really seeing what needed to involve for us. And we went live on the 8th of April. Not all councils decided to go with a helpline. We did. We recognised, obviously, as I said, that there were several already operating, but that there wasn't a consistency to that across the city. Obviously, every area didn't have one, so we decided to go with one ourselves, but also link into those local helplines as well. By the 24th of April, just showing you the demand that was out there, our regional stock in terms of what DFC were anticipating supplying us with in food parcels was met. And they introduced a cap at that then of around 4,700 food parcels per week coming to Belfast for onward distribution. Really then, in terms of the scheme preparing to close and lockdown measures lifting, around about the 7th of May, we started, as I said, to call back residents, see where they were at, make sure, that they were linked into other services, reminding them that the scheme was closing, just checking in basically to see, were they still in need, and whether that was going to be a longer term issue or not, and if it was, plugging them in wider. On the 26th of June, then the self-referral food parcel scheme was stood down. That was the end date agreed by DFC. However, we had conversations with DFC in terms of the shielding, and we were actually able to extend that then. So 900 shielding individuals were continued to be supported, but at that stage we moved from the hub being in the Ulster Hall, where it was an operation for the city and for a much larger, just under 5,000 people, to the Inverary Community Centre being brought on board, and Red Cross really stepping in as our delivery partners in terms of getting those food parcels out there, which was great. And then at the end of July, that food parcel scheme ceased to operate. So really just a wee bit of a focus on this slide in terms of the grants. Very, very quickly at the start of the process, we put out 120,000 of emergency response to 9 strategic groups. Those 9 strategic groups were identified by elected members, and again trying to ensure coverage across the city, north, south, east, west and Shankill as well. On the 9th of April, again, further funding went out to those groups, and it focused on much of the similar sort of issues that were coming through the helpline, as in food, connectivity, financial advice and support, prescription pickups, things like that. It was really up to the partners to liaise with us on broad themes about what they were going to do activity-wise under that. We also then looked at, again, with guidance from elected members about thematic funding. So obviously everything's not just focused on geography, and there was some certain thematic groups and thematic needs that were coming out, such as mental health, BME, domestic violence, and actually the presentation from Malina links into that later on in terms of the specific needs of the Roma community. So we picked up those as well and put out additional funding via that process. In July, again, there was further funding went to the 9 strategic groups, this time focusing on recovery. So coming out of the process, moving out of response into recovery, and what kind of activities would need to be picked up under that. And we also, which was a change for council, looked at how could we get quick small amounts of funding out, maybe wider than the usual suspects. So we went with a summer funding programme, and again that was focused on recovery. Small grant focused up to £1,000, very, very quick turnaround. You were seeing grants sort of being turned around within 17 days under that process, and getting, as I say, a much wider reach for that, very, very much down to grassroots level, which was great. Just in terms of making a difference, there's 3 slides here, and as Brenton said, you're going to be able to receive the presentation, so I'm not intending to read all these out, but we had great response from both community people that worked within the hub, because we had to reassign staff, I suppose, to work in the helpline to pick up the calls, and elected members as well. So, whether that was about the food, whether that was about the people delivering the food, the time they take in terms of, getting these to elderly residents a lot of the time, and the additional measures that we're going to do that, especially in light of COVID and the risks in the pandemic. But even that one from the agent, as you see there, the highlight for me was being able to make a difference to each individual, and recognizing there that their needs were much, much wider. And sometimes it was just about being that contact point, that listening ear at that time. There's some more then, from DFC, from a partner organisation, again, about the delivery drivers and the time they were taking. That's from a social worker. And then again, somebody else that was realigned to the hub you know, and the range of stuff that they were supported in. And again, as I said as well, it was very much a signposting role, you know, so those staff were linking in with community and voluntary providers, talking through needs and issues and linking people into the right support, and getting real satisfaction from being able to do that. There's one just from a resident: these kind gestures restore our faith in human nature, give us a feeling of community spirit. Thank you so much. And again, the community group, you know, recognizing again the sector and how quick they were, and how that flexibility to respond, and the want to build on that, which I'll come to later. Process, this is just really a process document which shows you sort of the key players in terms of the hub response. So obviously we had DFC as the driver and the funding body. We then had Belfast Health and Social Care Trust, which is who we were linking in with in terms of particularly the shielded patients and their wider needs, and then linking them with the food parcel scheme. Advice NI is the regional helpline, and how we linked into that, both in terms of feeding up and then feeding back and linking into local services. And then the Belfast hub itself in terms of the helpline and the food parcels. And then that one really underpinning all of it underneath in terms of funded community and voluntary groups providing that direct support. The food distribution, as I said, I'll not go into that in great detail. The heat map really there shows you the concentration of where those food parcels were distributed, and they were right across the city. The contact centre, as I said earlier, handled an awful amount of calls. And the other point to mention there is there was also an email contact process, and at the peak of it, you know, there was 300 to 600 emails coming in through there each day. The area teams, which was really the part that I linked in with most, as I say, was getting them established, trying to put people into them that had some knowledge of the localities, you know, so whether they worked in community safety or good relations or parks outreach, you know, we were trying to align them so that there was maybe people there who already had some local knowledge and some local relationships, and then building on that. A lot of it again was food related, and the need to link in with local services then if it was more you know, a specific need around food or hot food, things like that. There was also then the prescriptions. There was also then just people struggling and needing linked in with more wider support, whether that was family support or emotional support. And again, as I say, you know, that relationship building with the groups on the ground was vital in terms of that. The grant funding I've covered, again, it's just to show you there maybe better in the table, just the range of funding and how it was distributed out. And again, just some of the key achievements. And as I said, the community and voluntary group, it was broad and wide in terms of what they undertook, whether it was resilience packs or funding iPads or Chromebooks, you know, making emergency payments, utilities were part of it as well in terms of whether people wanted or needed support with that. And obviously the role of the local helplines as well. So there's been massive lessons learned and a wide range of information gathered and gleaned and that we're looking at and has been acted upon and continues to be acted upon. And really we were talking at a time about recovery plans, and we're still focused on developing recovery plans, but obviously with the recent restrictions, we're sort of veering in and out between response and recovery. But certainly the lessons that we have learned is, you know, the ability to be responsive, and we have been, you know, CMV sector was flexible and agile, but we're hopeful now that we have demonstrated that we actually can cut through the red tape and we can be flexible and agile, particularly in terms of some of the things like as I say, the micro funding, the funding schemes that have been able to sort of flex and shift, if you like, to suit the importance of the relationships, maintaining them and building on them at every level. And also the capacity that's out there, but being mindful of that capacity and the pressures that's being put on in terms of delivering, you know, and the additional asks that are going through. The opportunity to work with partners now on that area approach, that's very much council's sense of direction, if you like. And again, whilst COVID has been challenging, for us it actually has shown the benefits of taking that area approach, of looking at things through an area lens. And then just the importance of the community infrastructure and making sure that it's supported and it's maintained, and that we sort of listen and react to the issues that are being raised. Just my last slide, you'll be glad to know. So next steps, as I say, it was looking ahead at recovery. It still is looking ahead at recovery, but it's maybe just taking stock and recognizing where people are at in terms of the current lockdown, the current restrictions, capacity to deliver, you know, a bit of burnout, and just being mindful of that. So it's slowly edging towards recovery. It's looking at developing the integrated services at that area working model. It's investing more in regeneration, other sides of the house outside of me, I suppose, in city and neighbourhood. It's about supporting local businesses, looking at jobs now, obviously with the impact of furlough and lost jobs and lost income. Building community capacity and resourcing the sector, and we will do that as council and obviously with elected members and partners, but it's also now influencing departments as well on the back of all that, which we're continuing to do. As I said, I hope that's me. Thank you.
Thank you, Kathy. Sorry, thank you, Kelly. That's great. I was very informative as well. It's interesting, Kelly, that I think, back in March, April last year, it was almost, I was going to say a novelty factor, but it was new to everybody. And, we were locked down, working from home. And there was this amazing sort of spirit of let's work together. What can we do to help our neighbours? And now it's nearly a full year since we first entered this whole thing. I mean, so I guess the needs are still there, but is the level of response, I mean, are you guys still in identifying needs mode, or you talked there about learning from things that happened last year, which is equally important, probably more important long term, but are there still those needs out there that are being met,
Yeah, no, there's still most definitely those needs. As you say, I think first time round it was very reactive, it was very quick, and I think the spirit's still there and the work's still ongoing and the need's still ongoing. I think we've maybe got a bit better structured this time because we had the summer to sort of regroup and take on board some of the learning. So the bit that I didn't cover there was, we're still continuing to meet as Trust, as Advice NI, as Fair Share, with food banks. We would have a weekly meeting with sort of those kind of players, and then obviously still linking in with the strategic partners. And that's really to manage the need and the gaps and the pressures. But this time around, as I say, DFC directed the funding for food to Fair Share, and Fair Share linking in with those structures seem like they're a lot more streamlined. But the need is still definitely there, and it's balancing that now with there is a bit of fatigue. The spirit's still there, but you have to recognise that people are tired, whether that's in statutory organisations or community and voluntary.
And like in that first phase of lockdown, we were blessed with this fantastic weather, and people could go outdoors or could go to their gardens if they had access to a garden. And it's different now with winter and it seems to be dark when you wake up and dark when you go to bed. I wonder as well about, sometimes we challenge ourselves about learning for how to deal with COVID issues, but one of the slides you put up there, it was like a heat map, and it showed you where the greatest need was, where the food parcels set that were going out. To me, that shows you where the need is within the city. So is that a lesson that COVID could take us for the delivery of other long-term services?
I think so. I mean, the challenge for us and why we did it on the heat map basis was because it only relates to, that where council was delivering the food parcels, I suppose. And it's like everything, it would need to be layered with other information. Sometimes we were finding maybe a particular area wasn't as well serviced with council food parcels, but because we were linked in with the other community partners and strategic partners, we knew they were being well serviced with, food parcels from other sources. So it's sort of like layering the heat map to get the foods, and obviously that was just in relation to food as well. But definitely, I mean, that's something that council's very keen on in terms of GIS mapping and, as I say, that layering concept. There's a wealth of data out there. It's just the time now, I think, you think you had the time to analyse it, to focus on the recovery plans, and then you're right back into response, I think is the issue.
No, I think it's very valuable to be able to see it that way. And as well as all the things you've outlined, there were local sports clubs giving out food banks and responding to needs in their area as well. So, and we all know that was happening citywide, and part of that spirit of helping out, was one of the big features of how Belfast did respond. Kelly, there's a couple of very practical questions, if you don't mind. Bernadette Cullen is asking, and you may not know the answers, what was included in the resilience pack? In the resilience packs, I thought that myself. The image came up there. What was in there?
Very, very different. As I say, it wasn't even just one organisation; it was several organisations, and I suppose it would depend on the target audience. So you would have organisations making packs up for older people, and maybe distributing them throughout the area. The shielding. You also have people making packs up for young people, and whether that was like crafts activities. We had ones that were putting in skipping ropes and. It was very creative, as I say, in terms of how people approach that. But again, it was maybe just the opportunity to rap a door, have a check-in, stand at a distance, have left you a wee something, and broadened it out beyond the food as well, you know.
Very good. That's great. And apparently, I had also asked, I think you've gone somewhere to answer this already. Has the hub and the food distribution been re-established in this lockdown? You talked about fair share taking on a coordination role and such like. Is that?
Yeah, so we checked in very early on, and as I say, Advice NI this time round felt that, you know, the links had been established. So nobody, I think everybody's went with the regional helpline. I know some of the local community helplines, certainly in this current lockdown, have re-established. And then, as I say, that weekly meeting really allows us, so for sure, you know, you can join them in terms of the food supply. There's schools, I think, and everything signed up now to their network in terms of availing of that, and that's where DFC directed the food supply. We have ongoing conversations with DFC as well. For example, just after Christmas, they now have a food pallet scheme, where organisations, community organisations, again across the region, can sign up and, you know, receive food pallets, and that included like toiletries, maybe nappies and things like that as well. So we've had some partners within Belfast sign up to that, but as I say, it's been very streamlined this time round.
Okay, and actually that feeds into a question from Judith McCann, who's asked about that linkage between council efforts and community efforts and how you avoid duplication. Actually, you know, so that people aren't, I guess, being over provided, or maybe some people are missing out because of duplication.
And that did happen, you know, hands up, that did happen, and we were getting reports of that, particularly say from our delivery drivers, you know, the ones that maybe were going into some homes and could maybe see other supplies, you know, there, but it was just the nature of the beast at that time. We did try to do it, you know, we would have linked in with community partners and cross-referenced, you know, maybe postcodes and things like that. And when we did that, it was very, very few and far between. You were really relying on the person, I suppose. And we did get that as well, you know, people phoning up and saying, I'm getting supported elsewhere. Actually, a lot of the feedback in terms of the DFC food parcels at the initial phase was they were too big. You know, got people phoning up and saying, we don't need all that, you know, can we come off? And, you know, so there was a lot of, as I say, there was a lot of learning from the process last time round. And obviously as well, the food parcels, you know, they were, I forget the term now, but, you know, there's non-perishable goods in them. You know, there were cupboard staples, you know, so it didn't suit everybody either. Whereas I think the fair share approach this time around is certainly allowing, you know, community and voluntary groups with refrigeration and things like that to have a much wider offering.
Okay, thanks. The questions are flying in now. So, Malina, if you're on standby, I'm going to have two more questions for Kelly before we move on here. So, Marie McCotter has asked, Kelly, first of all, an excellent presentation. A lot of people are praising your presentation, rightly so. And Mary wants to know that as part of that recovery and learning, will Council challenge the inequalities that you did come across, you know, as you're going forward with other work, and including the part of the DFC anti-poverty strategy? So I guess that's probably a wee bit of a repeat of what I asked you about the inequalities you discovered earlier on. And you have talked about how to try and take that information in the policy forming going forward.
And there'll be two bits to that. There'll be the internal and the external. So obviously a lot of people on the call know that we're looking at community planning and reviewing and refreshing the Belfast agenda. So I think we have to take account of that information, you know, as part of that process ourselves and with partners under community planning. And then, yes, definitely, you know, I've said that. I think the other bit is going back to funders. You know, because and challenging what we're being funded to do, and again sharing with them that information we're gleaning. So, you know, that's going to be an ongoing process. As I say, I think there was a push for a while there, you know, to pick up and speed up with recovery. But that's, you know, a lot of people are still, what we're hearing from community and voluntary is we are still in response mode, and when we get our head above water, you know, we'll be able to pick this up again, and we just need to acknowledge that.
Final question, Kelly, you'd be glad to hear. Sort of strays into the personal even a little bit. Joan Malafany from, I think from Belfast Trust, to say just, you know, that the work that you and your team have been involved in, you know, Joan has seen some of people being affected by burnout, by anxiety. I mean, so she's asking, how do you keep going? How does your team keep going when you know that the needs that you're meeting continue, they're severe, and the people do need to be supported?
Yeah, it's hard, and to be honest, it has had an impact. We have had people off, you know, we know that there's people off in organizations that are struggling or telling us that are struggling. We're actually starting to see organizations as well say no to further funding, which I think might seem like a bad thing, but it's actually a good thing. It shows people are in the right space and know their limits basically as to what they can cope with. It's just challenging, but I think it is that spirit. It's just the spirit of wanting to help, I think, that keeps you going no matter what sector of the sort of playing field that you're in, but it is difficult. The homeschooling, my youngest is now running back and forward across my living room here. He's doing his PE session while I speak, but it is challenging. But and I think that's the thing, just being kind to each other and knowing that the pressure's being felt across the system, because I think that you do get a bit of feedback, oh, but you're working from home, as if it's an easier thing. And when you're on the computer, like a lot of us are, from 9 to 6, it's not really an easy thing.
Yeah. Well, okay, thanks a million. And I must say, there's a lot of praise and compliments coming in for the work that you've been doing, for the presentation you've given us today, and for the work of your colleagues in City Council too. So thanks a million.
Very much.
That's been really, really informative. And Malina, I'm just going to put you on notice that in a few moments I'm going to ask you to start your presentation as I introduce you, if that's okay. So Kelly's presentation, one of the slides in the early part of the presentation talked about vulnerable groups and perhaps hard to reach groups, and groups for whom English may not be the first language either, which brings us right into the presentation and the work of Malina Virtejanu from the Forward South organisation. And Malina works as a helpline support coordinator advisor within Forward South Partnership and hosts the Roma Helpline. And of course, has been doing that remotely ever since last spring, since last April. Malina would work very closely with Belfast City Council Good Relations Unit, as well as the Belfast Trust, the Public Health Agency, and food banks right across the city. And she's worked very closely this last 3 years in different roles, all to do with the offering support and practical advice to the Romanian Roma community in Belfast. And the work, which is recognised by the Romanian Embassy in July 2020. And Malina juggles all of this with her own parenthood, mother of 3, and campaigns tirelessly to raise awareness of minority rights, culture and integration for the Romanian community living in Northern Ireland. So I think we're all very interested to hear how that particular community was affected, Malina, and what the response was from your organisation. So over to you, please.
Hi, my name is Malina Virtejanu, as I mentioned earlier. I'm an associate of Forward South Partnership board. I've joined this Roma COVID helpline response remotely from 22nd of April last year. Okay, Anne, thank you very much for helping me out with the slides, because I'm entering from my phone in this moment. I have had some difficulties with my laptop. Okay, now I can see it. So our project is dedicated to the Roma community living in Belfast, and we have been called Roma Helpline since 22nd of April last year, when Forward South was invited by Belfast City Council and Belfast Trust to host this helpline in order to try to support or to access Roma community living in Belfast and with their struggles in relation with COVID, lockdown, and other aspects of their life here in Northern Ireland. If we can move to the next slide, please, Anne. Thank you. This was one of the flyers that we have used since July. It was translated also in Romanian, and from different organizations, they have been shared within different parts of Belfast in order for people to try to access our services. We have been very happy to take on board this project, because Forward South was already delivering a service to the Roma community from their premises, like face-to-face appointments for the Roma community for the resettlement scheme. So I was the person employed by another organization hosted by Forward South in order to help this community and European citizens to access their immigration status through the EU settlement scheme. And in this way, we have built a very good trust within the Roma community. And from here, I have been invited to do this work since April last year. You can see from here that we have used a mobile number where we have tried to work 25 hours per week remotely to try to access and to support the community in Belfast. If we can move to the next slide. Anne? So Forward South Partnership, because I've mentioned earlier, was already delivering a face-to-face project together with Stronger Together Network for the resettlement scheme that they were invited by Belfast City Council and Belfast Trust to administer and manage a citywide COVID helpline in order to enable the Roma families to access appropriate support services in their own language. And which was very good was the fact that Belfast City Council acknowledged the need for targeted intervention for vulnerable community, especially the need of the Roma community, because they work closely with them probably for more than 20 years already. So the Roma helpline was operational from 22nd of April, and this year Forward South is developing a Roma support hub that was a really it was a very good fact where we have identified all these gaps and we have tried to act on them, and this was just a response to the need that we have identified over the helpline. We are working collaboratively by bringing together other community services and food banks to reach and support the Roma community. We are working together with other community organizations like Advice and I, Housing Rights, and also all the food banks in Belfast. And we also were able to identify at some point and to try to avoid the duplication of the food packages, like my colleague mentioned earlier. We have worked together with the South Belfast Food Bank, Storehouse, and the Larder in East Belfast. We are operating remotely by phone 25 hours per week, Monday to Friday basis. We have operated as a response of the need. We have tried to operate together with the Belfast Trust, an advice clinic hosted in November and December, trying to integrate as well the lockdown measures. And when we were able to enter into an office in a safe manner, we were able to deliver also an advice face-to-face, all COVID health measures in place. And afterwards, we can explain that we are offering free advice and signpost to the existing food, nappies, milk vouchers, enable to secure and to store this baby milk formula. And we were able to, with the support of the Belfast Trust, we were able to use these vouchers and to give them to the families, and in order for the children not to starve at some point. Food banks have also delivered toiletries to the Roma community. We are offering free signposts to Housing Rights, where we work collaboratively together, and we are sending referrals depending on the need. We are sending referrals to our Housing Rights, and we are trying to work together to get an outcome for the families in need. We are offering signposts to benefit advice where people are trying to access, for example, universal credit or different problems in relation with their advice, together by sending referrals towards Advice and I. In this moment, we are able to say that we are working together with NIACRO that has received some from Belfast City Council COVID funding for emergency support for people who have lost employment or they are unable to access their universal credit because of their immigration status or other issues that we identify over the phone. And we are also offering signposts to immigration advice for people who are trying to access their rights and to the rights to reside, work, and we are signposting them to the organization, one of the organizations that has received the funding from Home Office, which is STEP and Stronger Together Network, where people were already using the services. If it's possible to move to the next slide. We can tell you that we have tried to capture as well some data, which was really useful in order to not only to say what is happening within the Roma community, but also to see numbers, which was actually probably some of the first time that when we are able to capture some of this. In this moment, until 25th of January, just a couple of days back, we have had almost 1,000 people, unique callers that have used our helpline in their own language, in Romanian or English, maybe because we have had also a couple of cases where local people have called in order to intervene for some of their neighbors, maybe, or if they have found someone to the street who are saying that they are hungry or they were unable to say what kind of problems they are, they have search on Google. Actually, they've searched on Google some Roma helpline. They've identified ourselves and they have reached the helpline. We can also say that we have each month almost 200 people that are returning to ask for different advice from our what is doing differently forward south with the other project that were developed to the Roma community was the fact that we have tried to identify the gaps and trends and to try to act on them, but working collaboratively with other organizations that were able with this COVID to stay together at the same table and to try to work for the best of others all together. We have tried to capture in here the data as well, how people are using, onto the next slide, if it's possible. Have tried to identify in here as well the way that the helpline is being used, and we can see that 65% of our callers are coming from the Romanian Roma community, and more than 30% are Romanians who are having, some of them maybe the same difficulties like lack of digital skills. They are illiterate, some of them, and they seem to struggle with the same problems, and they have tried to ring our helpline at least as a starting point, and afterwards to be able to be signposted to the relevant community services that were already offering support. We have had Hungarian Roma that have used our helpline, Moldavians, Portuguese people that have called, and where we were unable to use the service, like if I wasn't able to speak in their own language, we were able to liaise with Belfast Trust and to send a referral in so that that family can receive support in their own language. If we are moving to the next slide, we are trying to capture on a monthly basis also the needs from the callers, and we can see from here, from this pie chart and the next one, I'm going to explain it. We can see from here that some of the calls were in relation with utilities. Maybe some of them have lost their employment during the COVID and they didn't have enough money to heat the house at some point, and we have signposted them, or we were able to send them vouchers to top up their electricity in the house. We have received questions in relation with legal advice, where we have some signposted people, maybe some to the consulates or to the embassies, or maybe law center and NI, depending on the need. We have tried to act and to try to send people to the relevant services. We have had a lot of queries in the last couple of months in relation with national insurance applications, where the job center are closed in this moment and people are unable to access in Northern Ireland new applications. They are not taken into consideration compared with England, where in this moment, where if you have your settled status or your settled status already received as an outcome, you can apply for a national insurance number. It's not the case in Northern Ireland, and we have also tried to educate people and to explain them what is the difference between here and other parts of UK. We have had queries in relation with education, where we have tried to work together with the social workers or people who are already working in the education authority with the Roma community. So we have tried to support them. Maybe at some point there were people who are unable to register their children into education. Some of them were missing education. We were trying to work together to send them in and to link them in with the proper support. We have had queries in relation with health, and at some point also with mental health, which was quite unusual for the Roma community to try to address these problems. We have had queries in relation with benefit advice and accessing this universal credit, given the fact that the majority of them are illiterate, or they are struggling with digital skills, or they have just small parts, or they have been signposted to Advice and I through a referral pathway, where they have been supported to access this universal credit by the help of a Romanian interpreter, which took some of the pressure from my shoulder because I was unable to sort tens of cases. So we have signposted them to Advice and I, where a caseworker together with an interpreter was able to work together with them to try to access this universal credit. at some point, this is one of the major things that we have discovered in the last couple of months, and they have been addressed by the managing director of Forward South. They have been addressed further. We have had queries in relation with nappies, toys, toiletries. We have had people who have lost their houses during the previous lockdown, for example, where they didn't have enough money to sustain the house where they live in. So some of them have left the country. Usually they were leaving the country during the summer and they were coming back at the end of August in order for the children to go back into school. And some of them have lost their houses. We have had cases where people lived at the same address for 10 years and they have went back to Romania because they didn't have employment. And when they came back, they no longer had the same house. They've lost the house. We have worked together with Housing Rights to try to address some of the problems, and some of them were taken as casework, and they have tried to sort out the situation together with the use of an interpreter as well. We have had more than 25% of our callers asking support in relation with the resettlement scheme immigration advice in order for them to access this immigration status in order to secure the rights to remain and work in to secure the rights to remain and work in here. We have signposted them to Step and Stronger Together network, where we have had cases outside Belfast. We have tried to signpost them to the relevant community services in the area where they live. And the majority from here, from the pie chart, we can see from here like a small, very large part, which is more than 40%, queries in relation with travel, isolation, quarantine advice, and most recently the COVID vaccine, which is concerning in all communities, not necessarily in the Roma community, but people are, even at this point, are saying that they are preferring to leave the country rather than to have the vaccine. And we are working in to educate people. And I even took myself as an example, and I have done the vaccine, and I have tried to explain what I've done, and I've tried to put it on social media where it's easier for them to access information. I have tried to put myself as an example to see that I'm safe after a couple of days, and they can ring me and we can have a chat in relation with this. And also through the help of the messages sent by public health agencies who have been translated in Romania. And at some point we have also build some audio and video content in their own language in order for them to understand. And after, just from that small part, to try to call me back at the helpline and to try to explain more about these problems. We have liaised with different consulate or embassy where we needed to offer people travel advice in relation with, I don't know, travel, for example, traveling from north to south and the quarantine measures, traveling to Romania if it's safe, if they have to be isolated, if they need to make a test, where they can book the test, what is the difference of between the private test and the NHS test, and that it's not okay for you to use the NHS test because it won't be recognized by the frontier police, for example, and they will be unable to travel and they will still need to do this test. Those have been some of the examples that we have had in the last month. In the next slide, if it's possible to help me out. We have tried to capture percentages of the needs from the call, and you can see from here that more than 35% of the calls were in relation with travel, isolation, quarantine advice, and most recently the vaccine and the tests. We can see from here that more than 26% of the callers were in relation with their settled status, because there were a lot of rumors in relation with this 1st of January. And some of the people from the Roma community have had the impression that they will be flee from the country. They will have to go out from the country because they didn't have their status. And there are a lot of rumors in relation with this, and we had to work together. I had to work together with the community and to try to explain them the rights to reside, and the fact that things are not changing, and they will be changing for people who have arrived here for the only as first timers after 1st of January, and for them the legislation will be completely different. The other relevant fact is more than 22% of the calls were in relation with food. And we can say that we have been very, very thankful of the fact that we are able to work together with the food banks and to intervene where people have been left without employment. And this was their only source of not necessarily as an income, just it was the only source where they can have food on their table for them and for the children. We are moving into the next slide. Given the fact that this helpline was working as a reaction of all the gaps that we have identified, Forward South was happy enough to put themselves together at the same table with different people and to try to apply for this Roma hub from at the end of last autumn. And they have applied and have received the funding for opening a Roma support hub starting this spring. In this hub, it will have 3 different roles, and now they are searching 3 people in order for them to secure this hub and to work together with Belfast City Council and Belfast Trust to have these people supported in a very cultural, to have a cultural approach and to try to bring them together and bring them in to use proper services and to go to professionals to have support and to not go somewhere else where they are not being maybe at some point helped in the way that they were thinking at. We can say from here that this hub is trying to be accessible for 28 hours per week. It will have a coordinator, and I have tried to put together just some of the just summarize some of the job description for each role. So it will be probably operational for 28 hours per week. It will have a Roma hub coordinator that will be responsible for those 2 other people, the Roma capacity worker, which will be 24 hours role per week, and the other one, the advice worker, 25 hours per week, where people can have access maybe face-to-face or remotely. They are working to try to find a way how this Roma support hub will be operational as soon as possible. The next slide is the structure of the program and some of the partners that we are having for the Roma hub. It's Belfast Trust, Belfast Health and Social Care Trust, Belfast City Council, Education Authority, because we already work together with them and signposting people on, Belfast, South Belfast Shore Star, South Belfast Roundtable, Public Health Agency, where we have translated a lot of materials in their own language and working on different videos, or just sending to the community the message from the Public Health Agency with the most recently and updated news maybe in relation with their health and what was happening with COVID. And at some point in November and December, we have worked together also with the Chinese Welfare Association that was hosting our advice clinics. We are going to the next slide. We are seeing here some feedback from our partners. I will just gonna leave you to read because I don't like to receive so many. And what I want to add, I will want to say the way that we are working together. So we have a monthly meeting with all our stakeholders where we are presenting our report. And we are explaining where we are trying to identify the gaps and the needs and trying to act on them. I think it was ended. We are working on an assessment basis. So each caller will call myself and I will try to make a small assessment to identify for each family and each person what are the needs. And afterwards, I'm trying to find a pathway to signpost those people to the relevant services and to identify if they no longer have work or their benefits are so low that they still struggle. We are signposting to the food banks where they receive a weekly food pack. For example, if they have problems, if in one family we identify 4 different needs, that will mean that for that family we will have 4 different referrals, maybe one for advice, maybe another one for housing, another one for food, and maybe some of them for legal advice, and they will be signposted depending on the need. If there are any questions, I'm more than happy to try to take them.
Thank you, Malina. That's terrific. Yes, we do have some questions, Malina, if you don't mind. So can I just start off by saying, very clearly, prior to the pandemic, there were needs within the Roma community which you were helping to meet and to give advice on. And your slide, which showed that the biggest percentage of people were asking for help around isolation and quarantine. So I just wonder, so COVID changed the areas in which you were giving advice, but has it also changed the structure that you used to give the advice?
It has changed everything. Like maybe at some point from one day to another, I just act as a response. I'm as my previous person, as the previous person was saying, that we are still acting as a response. And depending what was the query, I was trying to identify where to signpost, where is the support in this moment. And we were able to identify with the other helpline hosted by Forward South. They already had a network. So I have used like a skeleton that was already existing. And afterwards, I just tried to link in with my knowledge and searching, a lot of research and documentary.
And I was wondering how your experience throughout the pandemic will shape how you deliver things in the future, but you've addressed that, and with the opening of the hub.
Have addressed them each week. We will have a meeting between ourselves and to have the supervision and to explain what are the gaps and trends. And when I will identify like a punctual press, like if I will have 5 similar queries with something that is outstanding, I will sign them as soon as possible, and we will try to send them further.
Okay. One of the questions from Marie McCotter has said.
Can you still hear me?
Yes, indeed. Yeah. We have a question from Marie McCotter again. Thanking you for your excellent presentation. And she's asking about the legal and the EUSS teams at STEP and the Stronger Together getting an increase in queries from people who, despite gaining their EU special status, are being refused access to health services post-Brexit. And is that something that you have seen an increase in since the start of this year?
I have seen a couple of cases where, for example, people were unable to finish their application, their GP registration, because they've been refused on the grounds that they don't have, I don't know, maybe their address. They don't have another proof of address, and they were unable to do it because they just recently came. And they were already in hospital, and they have received a letter from the trust saying that they need to explain what they are entitled to access the health support for free.
And Malina, one of the areas that Belfast Healthy Cities is always very keen to keep in the public domain is the issue of health literacy. You know, do people understand sometimes medical instructions, not just to do with COVID or the vaccine, but in general terms? People might struggle to understand the details of when to take a prescription, why you should be taking certain medications, what time of the day to take them. You have flagged up, you know, part of the work of the hub going forward might well be to try and educate and inform people around, yes, COVID vaccines, but other issues as well.
And they are trying to build a couple of champions within the community as well, that we work together for the good of others as well. So they are planning, Forward South is planning to this, including this into this hub, to have training for the Roma community and to bring together a couple of young people who will want to sign up for a training to become interpreters. Some of them will want to have a training on health, and afterwards to try to maybe to do some advice clinics, or to just to go back into the community and to spread the word. And maybe in this way people will engage more afterwards to understand. And they have built, I think they have been in the past a lot of health clinics, or people have worked together to trying to explain the community. It's just the fact that at some point everything disappeared and they didn't have a place where to go. And this came out absolutely good because of so many rumors, or people didn't have an access to a point where to address their problems. They just had the impression that they have been left out.
Thank you, Malina. That's been really, really informative and educational as well. There's lots of praise coming in on the Q&A for your presentation and for the content, so thank you for that. Joan, if you could be ready, I'm going to bring you in just one moment to round things off. And I'd just like to, on behalf of Belfast Healthy Cities, thank both Malina and Kelly for the presentations. Thank all of our attendees who registered and logged in today. We do find that these online seminars work for us. We try and keep them nice and compact, and we are just a little tiny bit over our proposed finishing time of 1:30, and we are wrapping up very soon. We will be back next week with a second look at how we can learn from how COVID has been delivered, and just keep an eye out on the Belfast Healthy Cities mailing list and on our website, because we do plan further on what are likely to be online seminars throughout the year as well. So, Joan, can I ask you to just, if you have any observations or anything you'd like to say on the back of the two presentations?
Thanks very much, Brendan, and thanks very much to both Kelly and Malina for two excellent presentations. And I suppose we can see the common themes and the success of why we've had the response in Belfast that we have had. And some of the issues are the really good partnership working that we have with in both presentations, the actual local knowledge, both of community organisations, of the other ethnic group associations, and of elected members that Kelly actually referred to. And really the flexibility and being able to adapt and being able to respond, it was actually amazing. And also the significant work that has gone on behind the scenes that most of us aren't aware of. And I think these presentations really demonstrated the speed at which organisations were able to respond, and the role of the council in coordinating, the role of the trust in being a key partner in all of this. And it was good to see actually Fair Share, who was one of our Healthy City Awards this year, the role they had that Kelly had mentioned. Also key, I think, it is to identify the particular needs of specific populations, and we can look then at the added work that has to go on in relation to the Roma population around language, around immigration, around I mean, really, the impact of so many people losing their jobs, and the impact that that's had on some communities, like they've lost their home as well. So the work that is going on is actually really valuable. And I think key to this is some of the issues that were raised in around recovery, the role of the hub within recovery, and actually even picking up on the point that you've referenced, Malina, about the vaccine and the uptake of the vaccine. WHO actually have conducted some surveys in relation to promotion of the vaccine, and really interesting point has arisen that actually women are one of the groups with low trust of the vaccine, which is quite unusual across Europe. It's usually women take responsibility for the family. Some of that information will be on our website in relation to or the part of our website that relates to COVID. But I think in terms of recovery, and these are, and Kelly has already referred to these, I'm sure most of you watch the 10 o'clock news every night, but I thought ITV news last night. Usually I'm a BBC watcher, but last night I watched ITV, and actually the information there, and this is no different across Europe, was saying that people who experience inequalities in health are 2.5 times more likely to die from COVID than those within more affluent communities. And that also links to some of the ethnic population as well. So there is something here in terms of the lessons learned or the current position in relation to recovery. But the value of some of this work has gone on it's really invaluable to the local populations, and particularly to the unique needs of the Roma population and some of those other populations. But I think there are key issues we can take up there for continuing or to address within the recovery plan. And I suppose you mentioned that too, Brendan, as well, in relation to the heat map. And the point that was made last night, we already lived in a very divided society in relation to inequalities. We just can't go back to normal, as some people have said. We have to take a serious look at these inequalities and how can we address that going forward. But thanks again for the excellent contribution. As Brendan has said, we do have the next week actually focuses on more on the built environment, or how we actually can begin to recover. What has been the impact of that, particularly on children and older people? And it's 3 colleagues from Queen's University actually will do the presentations. And just to say thanks to both of you too on behalf of Healthy Cities, because the presentations at the WHO annual conference were really exceptionally well attended. The presentations from Belfast, we submitted 7 abstracts and 6 of them actually were accepted at the annual conference. And there were collectively, there were almost 2,000 people linked into that. Normally, we're only allowed to take 5 people from the city to that conference. But because it was online, and that's also a lesson for all of us in terms of going forward. But thanks again to you, excellent presentations. Thanks to Brendan for chairing, and also to Anne, who does all the hard work behind the scenes. So thanks a lot, and hopefully you're able to join us next week.
Thanks, Joan. And yeah, reiterate thanks to Anne McCusker behind the scenes, putting all the slides and the technology together. Always a great help. So look, folks, that brings us to an end. There will be evaluations sent out, I think, this Friday. If you could take a moment or two to get them back into us, it helps to inform as we plan future seminars and future events. Just as a reminder, the recording of today's event, along with the 2 presentations, will be on the Belfast Healthy Cities website. So thank you for joining in, and hopefully we will see some of you next Wednesday as well, and enjoy the rest of your day. Thanks, folks. Bye.